Good morning, everyone. At the outset, I would like to thank the organizers for giving me the opportunity to talk about lacunae in research in pediatric nursing practice. Pediatric nurses, we know they do a very challenging job, and pediatric nursing practice is a very specialized field because it requires unique knowledge, skills, and compassion as well. Because they are dealing with small children, they are not miniature adults, but they are small angels, and therefore it really requires a lot of uh, commitment and compassion. And despite significant advancements in pediatric care, we do realize that there are gaps in knowledge and practice that continue to impact the quality care that is provided to the children. And in this presentation, I would like to highlight on those gaps. Pediatric nursing, it actually starts from infancy and then we move on to toddler stage, preschoolers, schoolers, adolescents. And the role of pediatric nurses, besides assisting with the medical care, they also provide mainly or primarily the nursing care, and particularly they meet up the play needs and emotional support of both the children and the family. We know that. And role of pediatric nurses, it's quite complex because it involves lot of their contribution to the evolving advancements in technology and also changes in the healthcare systems. It's not like 2 decades before or 3 decades. A lot of changes have occurred and a lot of advancements have occurred, and therefore the nurses must be, pediatric nurses must keep themselves in par with the changes that are happening, and they have to update their knowledge. And so the gaps do exist, and particularly this gap can affect the quality care, the patient outcomes, and overall effectiveness of nursing practice in pediatrics. And particularly, which are the areas? We can quote many areas, and I can specifically say in pain management. Pain is sort of undermined in children because either they are not able to express or somehow it is missed out by the parents and by the healthcare professionals. I'm not saying 100%, but definitely it is undermined in children. Communication, again, they are not, especially children who are very small, unless we give them a small notepad where they can draw up their emotions, or they, through stories will be able to elicit their emotions. And adolescents, maybe we have to put their hands around them and just give them, sitting at the level of them and giving our eye contacts. And if we talk to them in a friendly manner, probably they will ventilate their feelings. So communication is a field where, again, they are not able to express themselves, and there is a gap. And integration of technology. Technology has grown so much in the present days, and therefore nurses should update themselves in the technological advancements as well. Further, complexity of modern healthcare environments has introduced new challenges in implementing practices that address the emotional and physical needs of children care. And family-centered care is, it has been there for quite a long. So involving the family members, particularly in decision making and even in the care, if the parents are allowed to do some of the care for the children, they feel so satisfied. So family-centered care principles and use of technology in treatment plans, all these are to be incorporated, and nurses must keep all those in mind. So the lack of adequate advances in certain aspects of standardized practices in the key areas such as pain management, communication, and integration of technology in the treatment, all these are the areas particularly should be looked into. Furthermore, the complexity of modern healthcare environment has introduced new challenges for our pediatric nurses. And addressing these gaps are very, very critical. Only then can we make sure that the quality care can be provided. We do have the NABH and nursing excellence coming and checking on all the standards. And for day-to-day care, we must make sure that these challenges are kept in mind. So how can the gaps be filled up? Mainly by making or translating the theory into practice, and the gap can be filled in by doing many projects, researches, wherein through the evidence-based results that come, we can make our practices better. I can quote some of the examples, like one of our students did a study on paracetamol for children with fever against paracetamol and tepid sponging, and she found that there was no significant difference except for the small short time in the acute stage. And therefore, we have outdated the tepid sponging procedure, which causes more discomfort to the children, and mothers also, they become so uncomfortable with this procedure. Amniotic membrane application for burns is another important evidence-based practice, which actually, even for children with major burns, 80%, 70% burns, they do well with this amniotic membrane application. They do not catch up infection, and the healing process also is far quicker and better when we apply the amniotic membrane. Oxygen via tent method, or against the nasal catheter method, where one of our ma'ams, she found that against the nasal catheter method is far effective, and therefore we've outdated the tents. And thromboflow application against IG, the ethanol glycerin application, or cold compress application for extravasation, there also we found thrombophobe is more effective, though it's a little bit costlier compared to the other two. Chlorhexidine wipes, which can be used for children in pediatric ICU setup, which can minimize the infection rate in children. And PICU score usage, the pediatric early warning score assessment in children can reduce the card calls. Even that we have found to be evident, and therefore it is introduced in every area. And necessity for a PhD also was identified by one of our PG students, and therefore now we have a good PhDU with 13 beds. So likewise, I can quote many examples where projects or studies have been done and they have been translated into practice. And therefore, we need to have research in all levels of students and in the faculty, and particularly the staff nurses also should get involved so that the results can be translated into practice. Pediatric pain management is one of the most challenging aspects of pediatric nursing, as children often have difficulty communicating their pain levels, and research has indicated lack of consensus on best practices for managing acute and chronic pain in pediatric patients. Studies also have identified gaps in the training of nurses in assessing and managing pediatric pain effectively. Family-centered care has become a hallmark of pediatric nursing practice. However, studies suggest that while the concept is widely accepted, its implementation often lacks consistency. Research shows that the pediatric nurses may struggle to balance medical responsibilities with emotional support for children and their families. Communication with pediatric patients, their effective communication between pediatric nurses and patients is crucial for successful treatment outcomes. Studies have highlighted the challenges pediatric nurses face in establishing trust and effective communication with children, particularly those who are nonverbal or have a developmental disability. Integration of technology in pediatric nursing, emerging technologies such as telemedicine, electronic health records, and mobile health applications have potential to revolutionize the pediatric care. However, research has shown that there is a lack of sufficient training for nurses in these areas, and therefore there is insufficient evidence on practice basis for best practices for integrating technology into pediatric care setting. So the field of pediatric nursing has made tremendous strides in recent years, but significant gaps still exist in terms of knowledge and practice, and these lacunae can impede the overall effectiveness of care and hinder the ability to provide high quality care, evidence-based, patient-centered care. And therefore, only by doing researches and by doing projects can we come up with the results, and that can be translated into patient care. Thank you for the opportunity, and God bless the team.